The early signs and symptoms of stage 1 HIV infection resemble those that occur with the flu and may include fever, sore throat, muscle pain, joint pain, swollen lymph nodes, often the earliest sign, rash on skin, in trunk, face, and limbs, nausea and vomiting, diarrhea, mouth ulcers, thrush, genital ulcers, night sweats, weakness and fatigue. HIV early signs and symptoms may appear after about 2 to 6 weeks after exposure to the virus. In most patients, the symptoms gradually resolve over a few weeks. Some patients have mild or no symptoms. Later in the disease process, progressive immunologic impairment, stages 2 and 3, the early symptoms reoccur and become more severe. Some HIV-related infections are more severe in women. For example, fungal disease, especially vaginal yeast infections, and cervical dysplasia. These later stage 3 or 8 symptoms may also begin and include weight loss, high fevers, nail changes in fingers and or toes, genital and oral herpes, breathing problems, chronic cough persists and does not go away, diseases and infections associated with immunologic impairment, fungal infections, pneumonias, and others, for example. Mental changes, like memory loss, confusion, for example. Most of the opportunistic infections that arise when an HIV patient progresses to AIDS are the same in men and women. Severe weight loss, pain with eating, skin rashes and cancers, and recurrent pneumonias are some of the most common problems that occur with HIV patients. Some HIV-related infections are more severe in women, for example, cervical dysplasia or precancer of the cervix, and fungal infections like vaginal yeast infections. There are 3 stages of HIV infection. Stage 1, flu-like symptoms after initial infection. Some patients have few or no symptoms. Stage 2, clinically latency, HIV inactivity and or slow progression of immunologic impairment. May last for 10 or more years in some individuals. Stage 3. After HIV reactivation and or HIV's progressive attack on the immune system, the damaged immune system has a reduced or inability to protect the individual from serious infections and other illnesses. This stage is termed AIDS. In this stage, lab testing reveals high viral loads and CD4 count lower as 200 cells per microliter. Having an infection with the HIV virus does not automatically mean that the patient has AIDS. As the HIV virus infects more and more CD4 immune cells and makes more copies of itself, the patient's immune system gets overwhelmed and begins to falter. When the immune system breaks down due to HIV infection, opportunistic infections like fungal infections, pneumonias, and cancers can occur. When this level of HIV infection occurs, it is called AIDS, acquired immunodeficiency syndrome. Some of the signs and symptoms of progression of HIV to AIDS are extreme fatigue, chronic diarrhea, infections and rashes of the mouth, anus, or genitals, extreme weight loss, fever and night sweats, lymph glands swelling, recurrent pneumonia, chronic cough and shortness of breath, memory loss, and depression. If you liked the video, please give it a like, share, subscribe to the channel, and click the notification bell. Please follow me also on Facebook and Instagram. That would help me a lot. Thank you very much and see you next time.